New guidelines out today are calling for a dramatic shift in how obesity is viewed in Canada. And they urge doctors to look at the root causes of obesity, not just to focus on weight loss alone. They also call for compassion and empathy and to consider the patient's goals for their health. The advice comes from Obesity Canada and the Canadian Association of Bariatric Physicians and Surgeons. Some of the factors the experts say need to be considered are genetics and biology. Trauma and mental health issues can also be factors in excess weight. 1.9 million Canadians are categorized as obese. That number has tripled in the last 30 years. For more on this, we're joined by Dr. Arya Sharma. He's one of the authors of the study. He's also the founder and scientific director of Obesity Canada and a professor of medicine at the University of Alberta. And he joins me from Edmonton. Dr. Sharma, thank you for joining us on the program. We appreciate your time.
Well, thank you for having me.
Let's start. Oh, sorry. Dr. Sharma.
Well, I was just going to jump in there because the figure that you mentioned, the 1.9 million people with obesity, that's severe obesity. When we take all of obesity, it's actually closer to about 8 million Canadians who now have obesity.
That's a much different figure for sure. Let's start first. You know, you've heard for years, focus on losing weight, focus on diet, but you're saying to focus on something else.
Well, you know, we've come to learn that obesity is really a chronic, often relapsing chronic disease that, you know, is very, very complex. So when we look at all of the drivers of obesity, you know, you've already mentioned some of them. We look at mental health, we look at trauma, we look at certain medications that people have to take to you know, that make it easier for them to gain weight. We understand the huge role that genetics has to play in this, that really sets up people for weight gain, especially when they live in an environment like our current environment. So this is a really complex issue. And ultimately, you know, when we talk about obesity as a disease, it is about the fact that obesity can directly affect, it can lead to many, many health problems. And so ultimately, the goal of obesity is not just to make, of obesity management is not just to make people lose weight, it's about to make people healthier. And that's really what the focus of the new guidelines is all about. So
if someone who is obese goes to their doctor, what should the doctors, you know, do? Like, give us an example.
Well, it would start by recognizing that this is a very sensitive issue, and you know, doctors should not just jump into a conversation about weight or give unsolicited advice about weight. They should really, you know, perhaps even first ask the question whether weight is of concern to the patient and whether this is something that the patient is ready to talk about. Because patients have experienced in the past that very often, almost no matter what ailment they take to their doctor, if they're carrying extra weight, they always get told to lose weight. But then they don't really get the support and the help that they actually need to achieve those, those treatments. So I think that's where it starts. The second part after that is to really try to understand what the root causes and the root drivers of obesity are for that person. As I've already mentioned, you know, there are so many different reasons why people have problems with weight. And before I give anybody any advice on what to do about it, I need to fully understand what the actual drivers are. And saying, well, you know, the person has obesity because they eat too much, well, that's like saying someone who has depression is depressed because they're not happy. You know, it really doesn't explain the problem. It just, you know, eating too much can be a symptom of an underlying issue, and it's about finding out what that underlying issue is. That needs to be the first step in trying to come up with a solution.
That's a great way to put it, actually. It just kind of clicked in my head when you said that. When you're talking about body mass index as well, that's something that we have focused on a lot, but now you're thinking of that differently too, right?
Well, body mass index, which has traditionally been used to classify obesity, we have to remember that body mass index is just a number that you happen to calculate from someone's height and weight. And so really, a high body mass index doesn't really tell me much about the health of someone. It just tells me that this is someone who's big. It does not tell me whether this person has any real health problems, because we know that, you know, there are people who live in larger bodies who can be pretty healthy. On the other hand, we have people who might fall below that famous BMI cutoff, but actually have a whole bunch of health problems that could likely get better with obesity management. So the advice here is not to focus so much on those numbers on the scale, but really to do a full assessment for each patient and try to, you know, and try to answer the question, is this a patient whose health is actually being affected by the weight that they're carrying? And is this a patient where weight loss or for that matter, any form of obesity management is actually going to lead to health improvements.
But the first thing you're saying is to go right to the issue itself as a doctor, not just say, go get one of those diet books, go, exercise.
Well, the problem that we've learned with all of the diet books and all of the, the do-it-yourself type approaches is that they kind of, go against the fundamental biology, which is, and the way I explain this to my patients is, bodies like to gain weight, but they don't like to lose it. And so when you try to force the body to lose weight by eating less, and it almost doesn't matter what diet you go on, ultimately your body is going to resist weight loss and is going to do whatever it can to put the weight back on. And this is why people fail, because you buy one of these books and you follow them to a T and you lose the weight and you think you're doing great, and 2 years later the weight's back. And that's fundamental biology. I mean, that's just how bodies work. I mean, exact same thing would happen if you put your dog on a diet or your cat on a diet. The weight is going to come back. That's how bodies work. And this is really why we consider obesity today to be a chronic disease, because what chronic disease means is that you're probably going to need a lifelong treatment. Like for every other chronic disease. When you have people with diabetes, well, that means you're going to be on diabetes treatment pretty much for the rest of your life. The same is true for people with heart disease, and the same, unfortunately, is also true for people with obesity. You are going to have to find a treatment that works for you and that you can actually stay on pretty much forever.
And just one final quick question. I'm sorry, I'm running out of time, but this is a fascinating discussion. Just finally, how big a problem is this, and how important is that we really find a treatment for obesity?
Well, I mean, we have to admit, and we say this in the guidelines, that our current treatments for obesity are very limited. Of course, we have our diet and we have our exercise, and we have our psychological interventions where we try to get people to change behaviors. We also have a very, very limited number of prescription medications that are effective but don't work for everyone. And then ultimately, we have bariatric surgery, which again, that's a pretty drastic treatment. And so we unfortunately, don't have a lot of tools, but let's at least use the tools that we have, because we know that these tools can make a difference for a lot of people living with obesity.
Dr. Arya Sharma, I'm afraid I'm going to have to end it there, but thank you for telling us all about this today. We really appreciate your time.
Well, thank you so much for having me.
Dr. Arya Sharma is in Edmonton.